the Academy 2018 annual meeting in New Orleans. I gave one of the two Thranhardt Lecture Awards talking about a femoral fracture brace replacing a hip spica cast in children 0 to 5 for femoral fractures. So right now the current treatment, the current standard of care for orthopedic surgeons is to put these children in a hip spica cast, which is a cast that goes along the whole body. And we have changed that to a fracture brace, which we can change angles, settings, and basically what we've done now, we've done it for 10 years and found out that the healing rates are the same as the cast. It is better tolerated by the children and families, and there was no difference in healing rates. So the brace now has been used at our center for 10 years now as a replacement to a spica cast. So I think what we found is over the past 10 years, we found a viable option that works better than the current standard of care. There's no difference in how the kids heal up, so we haven't lost any of that, but it's much more easier for the families, the patients, and the treating doctors. So hopefully that's something that the people in other parts of the country can pick up on and use this technique to make it easier for their kids and their doctors as well. It's really not new technology, but it's just a new arena for it, and it works out very well. So we're trying to get it in the hands of other people and answer as many questions as we can to get that to them.
Today at the 2018 Academy meeting, I gave the second Thranhardt lecture. And in this lecture, I presented research from our lab at University of Illinois Chicago, where we're trying to develop and design and validate a new clinical balance test that's a better predictor of fall risk in lower limb prosthesis users. And what we ended up doing was developing a novel narrowing beam walking test. So it's four 6-foot long segments that progressively get narrower. And we found that through our research, this narrowing beam walking test was a better indicator of fall risk than existing clinical balance tests. The main message I think I would like people to leave with is maybe twofold. One, I hope they can appreciate kind of the potential utility and novelty of the test that we have presented to them today, this narrowing beam walking test. But bigger picture, I want them to kind of appreciate or understand before they use existing clinical balance tests or tests for mobility, that they understand a bit more about their pros and cons, their strengths and weaknesses, rather than just using them without any consideration whatsoever. So in the future, we're hoping to take this clinical narrowing beam walking test from a test of who's at risk for a fall and understand a bit more about the biomechanics required to maintain your balance on each beam segment, so that we can use the beam walking test as an indicator of why someone's at risk for a fall. What's the cause of their balance impairment, not just do they have a balance impairment.
It was a great forum to present this, and I'm just very thankful to the Academy to honor this lecture with a Thranhardt Award.